This is Justin with the Restore Clinic. Today we're talking about your thyroid and its relationship with insulin production. So, is there a relationship between one's thyroid function and the development of insulin resistance or diabetes? Well, the short answer is yes, and there's also a long answer. But for the short answer, sure, yeah, your thyroid function can be involved in the possible development of insulin resistance. Furthermore, literature has shown us that, literature is trying to demonstrate that there is a positive relationship between your TSH level, as well as your A1C, your HOMA-IR, and the possibility of developing fatty liver disease. Now, just because your TSH is, a little bit on the higher side, does that mean you're actually going to develop one of these metabolic diseases? No, not necessarily, but it could imply that the propensity towards developing one of those could be higher than it should be. So both overt hypothyroidism and subclinical hypothyroidism are both closely linked to type 1 diabetes and type 2 diabetes, but also vice versa applies as well. In fact, statistically speaking, about 15 to 30%-ish of type 1 diabetics have or will develop Hashimoto's disease. If you don't know what Hashimoto's disease is, check out some of the previous videos I've done on it. It's an autoimmune disease of the thyroid gland characterized by the presence of TPO antibodies. Anyway, so if these type 1 diabetics do develop Hashimoto's disease, they tend to develop it earlier in life. But what's even worse is if they also have concurrent Hashimoto's disease, these type 1 diabetics tend to have more severe forms of, or a more severe form of type 1 diabetes. In fact, about 25% of type 1 diabetics will have Hashimoto's earlier in life, usually adolescence or maybe plus or minus a few years. Also, LADA diabetes, LADA, or latent autoimmune diabetes of adulthood, is also closely related to the development of Hashimoto's. And LADA diabetes, if you don't know what it is, some people call it type 1.5 diabetes. It's also a form of autoimmune diabetes in which there's a presence of GAD antibodies. So both, on the other hand, type 2 diabetes and insulin resistance and metabolic syndrome, those are more tied to subclinical hypothyroidism. Now, subclinical hypothyroidism is where your TSH typically falls between 4 and 10, but your free T3, your free T4 values are still within normal parameters. I previously just mentioned that type 1 diabetes is more associated with Hashimoto's disease, but like I said, type 2 diabetes, insulin resistance, are more closely related with subclinical hypothyroidism. Now, that's not to say it can't flip over and become overt, because in fact, most subclinical does, but this is just what we see typically early in the course of the metabolic disease. In terms of the mechanism of action of how your thyroid regulates your glucose levels, your insulin levels, yes, your thyroid is directly involved in that. If you recall a moment ago, I said that subclinical hypothyroidism, and that's where your TSH is, between 4 and 10, but your free T3, free T4s are still within normal parameters. Subclinical hypothyroidism is closely related to metabolic syndrome and type 2 diabetes. This makes a lot of sense because if you're subclinical, you're not producing as much insulin, yet your TSH is marginally elevated, and therefore you're not overtly diabetic at that point. Even some of the literature has shown that higher TSH values, not even robustly higher, just marginally higher, are associated with higher A1C values and lower insulin levels. Now, another key point to keep in mind is metformin, which is a diabetes drug. That drug can actually lower your TSH and increase your free T4. So if you are pre-diabetic, you're insulin resistant, you're on metformin or you get on metformin, that's another thing to take into consideration, that it's actually going to help. It's going to take some of that load off your thyroid gland. The thyroid hormone T3, it also has activity or involvement in glucose disposal. So T3 will upregulate GLUT4 activity of skeletal muscle, and GLUT4, its big job is the trafficking of glucose into skeletal muscle and also increasing the insulin sensitivity of skeletal muscle. So when you work out, you train, you're going to dispose of that glucose a lot more efficiently. And lastly, thyroid hormones receptors are also dispersed throughout the liver. And when thyroid hormone binds these thyroid receptors in the liver, it upregulates PPAR alpha activity, and that's going to increase beta oxidation of fatty acids. Therefore, you're going to burn more fatty acids, you're going to prevent the accumulation of triglycerides in the liver, and ultimately this will help increase insulin sensitivity in the liver and prevent you from having fatty liver disease. Thanks for watching. Don't forget to hit that subscribe button and follow us on TikTok and YouTube.